In the silent depths of our bodies, an invisible army tirelessly works to keep us alive. Billions of cells, each with a specific purpose, form an intricate symphony of life. But what happens when one section of this orchestra goes rogue, when the very cells designed to protect us turn into a relentless enemy? This is the harrowing reality of leukemia, a group of cancers that originate in the blood-forming tissues of the bone marrow. It's a disease often cloaked in mystery, feared for its swift progression and complex nature. Today, we embark on a journey to unravel the intricacies of leukemia, to understand its origins, its devastating impact, and the relentless scientific quest to conquer it. Prepare to delve into the microscopic world where life and death hang in a delicate balance. Before we delve into the disease itself, let's establish a foundational understanding of our blood. It's far more than just a red fluid, it's a complex connective tissue vital for transporting oxygen, nutrients, hormones, and immune cells throughout the body. Comprising red blood cells, white blood cells, platelets, and plasma, each component plays a critical role. Red blood cells carry oxygen, platelets ensure clotting, and plasma transports everything else. Our focus today, however, will primarily be on the white blood cells, or leukocytes, as they are the primary protagonists in the story of leukemia. Understanding their normal function is key to grasping what goes wrong. The birthplace of all these vital blood components is a spongy tissue nestled within our bones, the bone marrow. This remarkable factory constantly produces hematopoietic stem cells, which are the pluripotent precursors to all blood cells. These stem cells have the extraordinary ability to differentiate into any type of blood cell our body needs, undergoing a complex maturation process. This tightly regulated process ensures a steady supply of healthy, functional cells. Any disruption in this delicate balance, any error in the genetic programming of these stem cells, can have catastrophic consequences, leading to the uncontrolled proliferation characteristic of leukemia. So, what exactly is leukemia? In essence, it's a cancer of the blood and bone marrow, characterized by the rapid production of abnormal white blood cells, known as blast cells. These abnormal cells fail to mature properly and accumulate in the bone marrow, overwhelming the production of healthy blood cells. Unlike solid tumors, leukemia doesn't typically form a localized mass. Instead, these cancerous cells circulate throughout the bloodstream, infiltrating organs and tissues, disrupting their normal function. This systemic nature makes leukemia particularly insidious, affecting the entire body rather than a single organ. Leukemia is not a single disease but rather a diverse group of cancers, broadly categorized based on two main factors: the speed of progression and the type of white blood cell affected. The speed refers to whether the disease is acute or chronic. Acute leukemias progress rapidly, often requiring immediate aggressive treatment, while chronic leukemias tend to develop slowly over months or even years. The type of cell refers to whether the cancer originates in myeloid cells or lymphoid cells, leading to myeloid or lymphocytic leukemias. These distinctions are crucial for diagnosis and for tailoring the most effective treatment strategy. Let's first explore acute myeloid leukemia, or AML. This aggressive form of leukemia arises from myeloid stem cells, which normally mature into red blood cells, platelets, and certain types of white blood cells like neutrophils, eosinophils, and basophils. In AML, these myeloid stem cells fail to mature and rapidly multiply as abnormal blast cells. AML is the most common acute leukemia in adults, accounting for approximately 80% of all adult acute leukemias. Its rapid progression means symptoms can appear suddenly, often requiring immediate and intensive treatment to prevent life-threatening complications. Next, we have acute lymphocytic leukemia, or ALL. This type of leukemia originates from lymphoid stem cells, which are responsible for producing lymphocytes, a critical component of our immune system. In ALL, immature lymphocytes, called lymphoblasts, proliferate uncontrollably in the bone marrow and bloodstream. ALL is the most common type of cancer in children, though it can also affect adults, albeit less frequently. Its rapid onset and systemic nature necessitate urgent diagnosis and a highly specialized treatment approach to achieve remission, especially given its prevalence in younger populations. Moving to the chronic forms, chronic myeloid leukemia, or CML, typically affects adults and progresses more slowly than AML. CML is characterized by the overproduction of mature, but abnormal, myeloid cells. A hallmark of CML is a specific genetic abnormality known as the Philadelphia chromosome, which results from a translocation between chromosomes 9 and 22. This translocation creates a fusion gene called BCR-ABL, which produces a protein that drives the uncontrolled growth of myeloid cells. The discovery of this genetic marker revolutionized CML treatment, leading to targeted therapies. Finally, chronic lymphocytic leukemia, or CLL, is the most common type of leukemia in adults in Western countries. It involves the slow, progressive accumulation of abnormal, mature lymphocytes, usually B lymphocytes. These cancerous cells accumulate in the blood, bone marrow, and lymph nodes, gradually impairing the immune system. Unlike acute leukemias, many individuals with CLL may not require immediate treatment and can be monitored with a watch-and-wait approach, especially in early stages, due to its slow progression and often indolent nature. However, it can still progress and require intervention. The precise causes of leukemia remain largely unknown, but a combination of genetic and environmental factors is believed to play a role. While most cases are not inherited, certain genetic predispositions, such as Down syndrome or Li-Fraumeni syndrome, can increase the risk. Exposure to high levels of radiation, certain chemicals like benzene, or some chemotherapy drugs used for other cancers can also elevate the risk. However, it's crucial to understand that in the vast majority of cases, there's no clear, single identifiable cause, making prevention a significant challenge for medical science. The disease often arises from random mutations. Recognizing the symptoms of leukemia can be challenging, as they are often nonspecific and can mimic those of less serious conditions, making early diagnosis difficult. Common symptoms include persistent fatigue, unexplained weight loss, recurrent infections, easy bruising or bleeding, fever, night sweats, and swollen lymph nodes. These symptoms arise from the bone marrow's inability to produce sufficient healthy blood cells. For instance, a lack of red blood cells causes anemia and fatigue, while low platelets lead to bruising and bleeding. A compromised immune system, due to dysfunctional white blood cells, results in frequent infections. The journey to diagnosis typically begins with a thorough physical examination and a review of the patient's medical history. If leukemia is suspected, a complete blood count, or CBC, is often the first crucial step. A CBC can reveal abnormal levels of white blood cells, red blood cells, or platelets, signaling a potential problem in the bone marrow. For instance, an abnormally high white blood cell count, particularly with immature blast cells, is a strong indicator. Conversely, unusually low counts of healthy red blood cells or platelets can also point to bone marrow dysfunction. If a CBC suggests leukemia, the definitive diagnostic tool is a bone marrow aspiration and biopsy. During this procedure, a small sample of bone marrow, usually from the hip bone, is extracted and then examined under a microscope. Pathologists look for the presence of abnormal blast cells and assess their morphology, or shape and structure. This biopsy provides critical information about the type and subtype of leukemia, which is essential for guiding treatment decisions. It allows for a direct visualization of the cancerous proliferation within the marrow, confirming the diagnosis with high certainty. Beyond basic cell morphology, advanced diagnostic techniques play a pivotal role. Flow cytometry is used to identify specific markers on the surface of leukemia cells, helping to precisely classify the subtype. Cytogenetic analysis examines the chromosomes within the cells for genetic abnormalities, such as the Philadelphia chromosome, and CML. Molecular testing, including PCR and next-generation sequencing, can detect specific gene mutations and rearrangements that drive the cancer's growth. These sophisticated tests provide a detailed genetic fingerprint of the leukemia, allowing for highly personalized and targeted therapeutic strategies. Staging leukemia is different from solid tumors, as it doesn't typically form localized masses. Instead, prognosis and treatment decisions are based on factors like the patient's age, the specific type and subtype of leukemia, the number of blast cells in the blood and bone marrow, and the presence of certain genetic mutations. For instance, in CLL, staging systems like the Ryan-Benet systems classify the disease based on lymph node involvement and other clinical features. Understanding these prognostic factors helps clinicians predict disease behavior and tailor the intensity of treatment accordingly. The primary goal of leukemia treatment is to achieve remission, meaning the absence of detectable cancer cells in the bone marrow and blood, and to eradicate the abnormal cells while allowing healthy ones to repopulate. Treatment strategies are highly individualized, depending on the type of leukemia, its aggressiveness, the patient's age, overall health, and genetic profile. The intensity and duration of treatment vary significantly, from short, intensive regimens for acute leukemias to longer-term maintenance therapies for chronic forms. The journey through treatment can be arduous, requiring immense resilience from patients and their families. Chemotherapy remains a cornerstone of leukemia treatment, especially for acute leukemias. It involves the use of powerful drugs designed to kill rapidly dividing cancer cells throughout the body. These drugs can be administered intravenously, orally, or directly into the cerebrospinal fluid. Chemotherapy typically involves several phases: induction to achieve remission, consolidation to kill remaining cancer cells, and sometimes maintenance to prevent recurrence. While highly effective, chemotherapy can also damage healthy cells, leading to significant side effects like nausea, hair loss, fatigue, and increased susceptibility to infections. Radiation therapy uses high-energy rays to kill cancer cells and shrink tumors. While less common as a primary treatment for leukemia compared to chemotherapy, it plays a crucial role in specific scenarios. It might be used to prepare a patient for a stem cell transplant, targeting the entire body to eradicate all existing bone marrow cells. Radiation can also be directed at specific areas where leukemia cells have accumulated, such as the brain, spinal cord, or testes, to prevent or treat localized complications. Its application is carefully calibrated to maximize efficacy while minimizing damage to healthy tissues. For certain types of leukemia, particularly CML and some forms of ALL, targeted therapies have revolutionized treatment. These drugs are designed to specifically attack cancer cells by interfering with the unique molecules that drive their growth, while largely sparing healthy cells. A prime example is the class of tyrosine kinase inhibitors, or TKIs, which specifically target the BCR-ABL protein in CML. The development of TKIs transformed CML from a fatal disease into a manageable chronic condition for many patients, showcasing the power of precision medicine in oncology. Stem cell transplantation, often referred to as bone marrow transplant, is a potentially curative treatment for many types of leukemia, especially for patients with high-risk disease or those who have relapsed. This intensive procedure involves first destroying the patient's diseased bone marrow with high-dose chemotherapy or radiation. Then, healthy blood-forming stem cells, either from a compatible donor, allogeneic transplant, or the patient's own previously harvested cells, autologous transplant, are infused into the bloodstream. These new stem cells migrate to the bone marrow and begin producing healthy blood cells, essentially resetting the body's hematopoietic system. The success of an allogeneic stem cell transplant heavily relies on finding a suitable donor whose tissue type, or HLA, closely matches the patient's. This match is crucial to minimize the risk of graft-versus-host disease, a severe complication where the donor's immune cells attack the patient's tissues. Siblings are often the best match, but unrelated donors from national and international registries can also be found. The search for a perfect match underscores the importance of bone marrow donor registries and the altruism of those who choose to donate, offering a chance at life to many patients. CAR-T cell therapy represents a groundbreaking frontier in leukemia treatment, especially for certain refractory or relapsed ALL cases. This innovative immunotherapy involves genetically engineering a patient's own T cells to specifically recognize and attack cancer cells. T cells are harvested from the patient, sent to a lab where they are modified to express chimeric antigen receptors (CARs) on their surface, which act like guided missiles to target a specific protein on leukemia cells. These super T cells are then multiplied and infused back into the patient, where they unleash a powerful, targeted immune response against the cancer. Supportive care is an integral part of leukemia treatment, aimed at managing side effects, preventing complications, and improving the patient's quality of life. This includes medications to prevent nausea and infection, blood transfusions to address anemia and low platelet counts, and pain management. Emotional and psychological support is equally vital, as patients and their families navigate the immense challenges of a cancer diagnosis and intensive treatment. A multidisciplinary team of doctors, nurses, social workers, and psychologists works together to provide holistic care, addressing both the physical and emotional burdens. Remission is a major milestone, but it doesn't always signify a complete cure. Regular monitoring through blood tests and bone marrow biopsies is essential to detect any signs of relapse. Some patients may require ongoing maintenance therapy, often with oral chemotherapy or targeted drugs, for months or even years to prevent the cancer from returning. The fear of relapse is a constant companion for many survivors, highlighting the long-term nature of managing leukemia and the need for continuous medical surveillance and emotional support beyond active treatment phases. Living with and beyond leukemia presents unique challenges. Survivors often face long-term side effects from treatment, such as chronic fatigue, fertility issues, or an increased risk of secondary cancers. Psychologically, coping with the trauma of diagnosis and treatment, and the persistent fear of recurrence, can be profound. Many organizations offer support groups, resources, and advocacy to help patients and their families navigate these complexities. The journey doesn't end when treatment does, it transitions into a new phase of survivorship, requiring ongoing care and resilience. Children battling leukemia face a unique set of challenges. Their developing bodies are more susceptible to the long-term side effects of aggressive treatments, impacting growth, development, and organ function. However, the good news is that the most common childhood leukemia, has seen remarkable improvements in survival rates, with over 90% of children achieving long-term remission due to advancements in treatment protocols. Specialized pediatric oncology teams focus on minimizing long-term toxicity while maximizing efficacy, ensuring children have the best possible chance at a healthy future. Research into leukemia is a dynamic and rapidly evolving field. Scientists are continuously unraveling the genetic and molecular underpinnings of the disease, identifying new therapeutic targets, and developing more precise and less toxic treatments. The focus is on understanding why some patients respond better to certain therapies, developing methods to overcome drug resistance, and exploring novel immunotherapies that harness the body's own immune system to fight cancer. Every year brings new discoveries, pushing the boundaries of what's possible in the fight against leukemia. One promising area of research involves epigenetics, the study of how gene expression is regulated without altering the underlying DNA sequence. Epigenetic modifications can play a crucial role in the development and progression of leukemia, and drugs targeting these modifications are showing promise. Another exciting avenue is the development of novel immunotherapies beyond CAR T cells, such as bispecific antibodies, which can bring T cells and cancer cells together to facilitate an immune attack. These innovative approaches offer new hope for patients who have exhausted traditional treatment options. The role of clinical trials cannot be overstated in advancing leukemia treatment. These carefully designed research studies test new drugs, combinations of therapies, or novel approaches in human volunteers, often providing patients with access to cutting-edge treatments before they become widely available. Participating in a clinical trial not only offers potential benefits to the individual but also contributes invaluable knowledge to the scientific community, paving the way for future breakthroughs. They are the engine of medical progress, driving innovation forward. Public awareness and advocacy are vital components in the fight against leukemia. Campaigns aimed at educating the public about symptoms, encouraging bone marrow donor registration, and promoting early diagnosis can save lives. Advocacy groups play a crucial role in funding research, influencing policy to improve patient access to care, and providing support networks. By raising our collective voice and understanding, we empower individuals and communities to take proactive steps, breaking down the stigma and fears surrounding a cancer diagnosis. The economic and social impact of leukemia is substantial. The cost of treatment, which can include prolonged hospital stays, expensive medications, and specialized procedures like transplants, places an enormous financial burden on individuals, families, and healthcare systems. Beyond direct costs, there are indirect costs such as loss of productivity, caregiver burden, and long-term disability. Addressing these systemic challenges requires comprehensive healthcare policies, financial assistance programs, and robust support services to ensure equitable access to care for all who need it. While this video provides a comprehensive overview, it's crucial to remember that every individual's journey with leukemia is unique. The information presented here is for educational purposes and should not be considered medical advice. Always consult with a qualified healthcare professional for diagnosis, treatment, and personalized guidance regarding leukemia or any health concerns. Self-diagnosis and self-treatment can be dangerous. Your medical team is your best resource for accurate and up-to-date information specific to your situation. Looking ahead, the future of leukemia treatment is filled with hope. Advances in genomics, immunotherapy, and targeted therapies are continuously reshaping the landscape, transforming previously grim prognoses into possibilities of long-term survival and even cure. The relentless dedication of researchers, clinicians, and patient advocates continues to push the boundaries of medical science, driven by the unwavering commitment to improve outcomes for all those affected by this complex disease. The pace of discovery is accelerating, bringing us closer to a world where leukemia is no longer a death sentence. We've explored the intricate world of leukemia, from the fundamental biology of blood and bone marrow to the diverse types of the disease, its challenging diagnosis, and the cutting-edge treatments that offer hope. We've seen how a microscopic aberration can unleash a profound impact on a human life, yet also witnessed the incredible resilience of the human spirit and the ingenuity of medical science in fighting back. It's a testament to human endeavor that we continue to make strides against such a formidable opponent, transforming despair into possibility. The story of leukemia is one of both profound challenge and remarkable progress. It reminds us of the fragility of life but also of the immense power of scientific discovery and human compassion. Every breakthrough, every life saved, is a beacon of hope, pushing us closer to a future where leukemia is not just managed, but eradicated. Let's continue to support research, raise awareness, and stand in solidarity with those affected, knowing that together, we are making a difference in the relentless pursuit of a cure for blood cancer. If you found this detailed exploration of leukemia informative and thought-provoking, please consider liking this video, sharing it with others who might benefit from this knowledge, and subscribing to our channel for more in-depth content on complex medical topics. Your support helps us continue to create educational videos that empower and inform. Don't forget to hit the notification bell so you don't miss our future releases. We believe knowledge is power, especially when facing health challenges. Thank you for joining us on this deep dive into leukemia. The journey to understanding and ultimately conquering such complex diseases is a collective effort, and your engagement is a vital part of that. We hope this video has shed light on a topic that affects so many lives and has inspired you to learn more and perhaps even contribute to the ongoing fight against cancer. Until next time, stay informed, stay healthy, and continue to champion the incredible advances in medical science.